We're going to next talk about interventions for healthy aging. I'm not going to talk about too many here. I'm going to talk about things that I have worked on, but there are many that we can really discuss. So there's a whole host that you've probably heard of already, from physical activity or exercise, strength training, yoga, to healthy behaviors, to sleep, to mindfulness and cognitive health, exercises, to community and belonging. So these overlap really well with what you probably hear in the wellness arena. So I'm not going to touch upon this much because you already have probably a lot of information on this. We all know this is important to do, but so I'm not going to talk much about it. Outside of that, there are many other interventions as well. Some of them are still at the research level. So for example, diet, it's something I have worked with very closely and I'm going to talk more about. And then supplements is also something I have worked with. So I'm going to talk about those two in particular. And then drugs is like it's an emerging area with a lot of hot research happening. However, we don't really have any drugs per se for aging because aging is not considered as a condition. It's not a disease, because of which we cannot really develop any drugs for disease. But there's a lot of pushback for it from pharmaceutical companies that are trying to get this definition changed so that we can produce drugs for aging. What's interesting, there are some conditions that are very strongly associated with aging, things that we didn't really discuss earlier, like sarcopenia, which is as you get older, you lose muscle weight, you lose muscle mass. You've probably heard of this term called wasting. So there are a lot of companies that are developing drugs for conditions like sarcopenia, okay? And there are randomized controlled trials happening around the world for some of these conditions, and we're yet to see how this field is going to move forward. And then we also have gene therapy. Gene therapy essentially uses manipulation techniques to change your genome. And this is also an up and coming field that's still at the research level. Hopefully within the next decade or so, we might see some changes that are relevant to this. And then digital health and AI, this is something that I am currently involved in within my company. This is to integrate technologies and develop technologies that can be used for older adults that can really improve their well-being and in terms of assistive technologies and things like that.